Hi, I'm Tori LaMotte, the District School Nurse for GKB. I'm bringing you a message today to share some recent changes in the guidelines from the Indiana State Department of Health. First, this week, the Indiana State Department of Health has changed these symptoms to be more streamlined to match the CDC. The biggest change for this is that they have removed congestion and runny nose as a symptom. So, the symptoms still are fever of 100.4 or greater and chills, a sore throat, cough or shortness of breath, diarrhea, nausea, and vomiting, a headache, new loss of taste or smell, and muscle or body aches and fatigue. These symptoms need to be screened every day to make sure we're not sending our students to school with the symptoms that could be consistent with COVID. If they have a chronic condition and that is documented, it is okay to send them if their symptoms are consistent with their chronic condition. Another change is close contacts. So they just added some guidance for us. If you are within 6 feet of someone who is considered to be a COVID positive case for more than 15 minutes throughout the day. So previously it was considered to be consecutive 15 minutes. However, it is changed to an accumulative 15 minutes throughout the day. So 5 minutes here, 5 minutes there of being within 6 feet and having that risk for transmission. If you provided care at home to someone who was sick with COVID-19, you would be considered a close contact. If you had direct physical contact with someone, such as hugging, kissing, handshaking, high-fiving, those would be considered close contacts as well. If you shared eating or drinking utensils, or if someone sneezed, coughed, or somehow got their respiratory droplets on you. As well as anyone who lives with or stays overnight for at least one night in a household with an infected person is considered at highest risk in the close contact. Another change that we have is that previously, if someone in the house was being tested, the family could still come to school. However, with these changes, the new guideline says that anybody who lives in the same household should be quarantined while waiting for test results from the symptomatic person. So this would mean that if we are sending a student home from school for potential COVID symptoms, we would have to send home the siblings as well. One of the biggest and most significant changes is that we were having to require our students to stay out for 10 days, regardless of a negative test result, unless they had clearance from their doctor or a primary care provider saying that they have an alternative diagnosis for their symptoms. This is not the case any further. Anyone with a negative test who has not been deemed a close contact of someone with a confirmed positive case can return to school if they have been symptom-free, their symptoms have resolved, and fever-free for 24 hours without any fever-reducing medications. So again, if you have a negative test result, your symptoms have resolved, and you have not had a fever for 24 hours, your student will be allowed to come back to school without a doctor's note anymore. So that is a pretty big change and something that will help us to get our students back into the classroom quicker instead of being at home and symptom-free. Additionally, if someone is sent home for COVID-like symptoms and does not get tested, they will be considered to be a positive case and would have to have their family members quarantine. So we would have to have the family home with them the entire time. So the best way would be to get tested and hopefully have a negative test result and then be symptom-free and be able to come back to school. I know that there have been a lot of changes, and we at GKB are trying our best to make sure we're communicating clearly these changes with you. If you have any questions regarding this, please feel free to reach out and we will help you as best as possible. Thank you for working with us, and thank you for screening your students every day before sending them to school.